Hi everyone, welcome. Happy Monday. We are going to start going and giving you guys some updates today. My name is Amanda Tamty. I am the Electronic Visit Verification, Communication, and Training Coordinator. I'm joined today by uh, others on my team. We have Sarah Wozniak, Janet Spath, and Melissa Loveday. And they'll be helping to facilitate questions as we move through the presentation today. We're going to start out today with a presentation and of updates and where providers should be at currently. And then we will have time at the end for Q&A. And we ask that you use the chat for that. This session is being recorded. If you would like to not be a part of the recording, be sure to mute yourself, and cameras are staying off. Everybody is muted, but just want to let you know so that we can post this after for people to review at a later time. Please hold your feedback or your comments until the end. We would like you to use the chat box, and your microphones will remain muted. So welcome. What is electronic visit verification? The electronic visit verification is a mandated electronic form of verifying services by the 21st Century Cures Act. All states must implement this. This is a federal law requiring providers of affected services to implement EVV. And doing this, it is in collaboration with the Minnesota Department of Human Services. We as DHS will provide guidance and policies to the providers to aid in implementing EVV, to also ensure that we, as a state, are meeting the requirements of the 21st Century Cures Act. To see a list of all the mandated services, you can visit our Minnesota DHS EVV webpage, which is also linked in this PowerPoint. And if you registered, you should have received a PDF of the PowerPoint. EVV requires the data collection of 6 components to ensure that the home and community-based services have occurred. The services are type of service performed, who received the service, date of service, location of service, delivery, who provided the service, and when the services start and ended. EVV is required for all mandated services, regardless of where the services start and end. So that means that services should be verified at home or in the community. DHS's approach to implementing EVV for Minnesota. DHS has selected the hybrid model, which means that a provider can choose the state-selected EVV system through HHA Exchange, and this is at no cost, or they can choose to use a third-party EVV system that meets the state requirements, and then must connect with the HHAX data aggregator. Providers should choose the system that works best for their organization and meets the needs of the people they serve. Excuse me. Providers that choose to use the state-selected system will be able to use the system at no cost, but there may be more time and resources that they will need to use in order to implement EVV and to meet compliance. Third-party system, EVV system users, providers can choose to use a third-party system or continue to use a system that they already have for their organization. The providers will be responsible for any costs associated with the third-party system. It sounds like some people are having a hard time hearing. Okay. Mong, will you just keep an eye on that and see? So providers that use a third-party system, they need to ensure that the third-party system connects to the state's HHA Exchange data aggregator, but also meets the state requirements that were posted by DHS. DHS is implementing EVV in a phased approach by service type. Providers are expected to implement EVV when their service goes live, and in accordance with the phase that they're in. So we launched on June 20th of 2022 for financial management services, FMS, for personal care. On December 12th of 2022, we launched the remaining personal care services. Phase 3 will be managed care organizations, which will be implemented this year. And phase 4 for home health services will be before the end of this calendar year of 2023. For those remaining 2 phases that are still planning to go live, MCOs will implement in the next few months. MCOs will be sending out welcome packets to providers that will outline the next steps to onboard, so please watch out for those, and when the implementation date for those MCOs will be. Home health providers have not begun the onboarding process yet. Providers will be given notice before the onboarding process will begin. The notification will direct providers to complete the provider enrollment survey for home health. So please watch for those. Billing with EVV. We are implementing EVV in a post-payment review, which is the current billing process of DHS. So providers will continue to use the current billing process while implementing EVV. EVV data will be used in the post-claim review process. This may result in takebacks from providers if claims are not supported by EVV data. DHS continues to explore billing enhancements within the HHAX system. Third-party system users, if that's how you bill with DHS currently, you can continue to do so. For those that use the state-selected HHAX system, that is not a part of the free system at this time. DHS has been working really hard on policies with EVV. We have used lessons learned from our first 2 launches to help drive the policy decisions for EVV. Some of the policies that we are working on are our compliance policy of when providers will be required to meet full compliance with EVV. We are working on what it means for live-in caregivers, the safe-at-home participants, and devices. We will notify providers of when these policies are posted to the EVV CBSM. That is also linked in this presentation, so you can check that. Providers may need to create additional policies for EVV to meet the business needs, but they will use the requirements and policies put out by DHS to do so. Currently, the requirements for compliance for providers is that we are implementing EVV in a soft launch approach. This allows providers time to onboard into their chosen system, but also allows time to onboard caregivers and members. We understand that it takes time for EVV to become routine for providers, caregivers, and members, and all those that are impacted. If you are a newly enrolled provider with DHS that are providing mandated EVV services, you must begin using EVV after enrolling with DHS if your services have already launched. And providers will receive notice before full system usage is required. Live-in caregivers. Live-in caregivers are considered a live-in caregiver for EVV when their residential address is the same as the residential address of the person receiving services. At this time, providers are not expected to enter data into the EVV system for live-in caregivers. We are still working to finalize the live-in caregiver policy. And providers that are using a third-party EVV system that have the ability to designate live-in caregivers may use this process in their system, but are not required to. Safe at Home. Safe at Home is a statewide address confidentiality program administered by the Office of the Minnesota Secretary of State. Safe at Home is designated to help people who fear for their safety to maintain a confidential address. Many times, program participants are survivors of domestic violence, sexual assault, or stalking. All public and private entities in Minnesota must accept a program participant's assigned address, and a participant cannot be required to disclose their real address. Their actual location cannot be collected. So at this time, DHS is not requiring participants in Safe at Home program who receive or provide services in scope to use the EVV system, regardless of what system a provider chooses. We are working really hard to determine the appropriate options to ensure that all information for participants in the program remains confidential. Devices. DHS is taking a mobile-first approach to verify EVV visits within the state-selected HHAX system. The mobile application is downloaded and used on the caregiver's smart device. DHS is working on alternative options for the mobile application, such as IVR, the use of a phone to clock in or clock out, and we will notify you when those options are available. Providers that are using a third-party EVV system will need to work with their vendor on device options for EVV. DHS does not oversee what devices are used as long as they capture the data points required for EVV. Providers can use the devices that work best for their organization. So we wanted to bring you guys back to the steps to onboarding. And so I'm going to talk through how to onboard with HHAX for both the state selected system and if you choose to use a third-party system. So the first step for all providers is to review the information session that is posted on the HHAX Minnesota Provider Information Center. You'll get an overview of EVV in Minnesota and the HHAX system. There are a couple different information sessions. So providers that don't have an EVV system or would like to use the state selected system to watch that info session. Providers with an existing EVV system or wanting to use a third-party EVV system, there's an info session under the EDI tab, and they can review that EDI information session to get more information about connecting their third-party system. Once you've reviewed and know what type of system you would like to use, then you must complete the HHAX provider enrollment survey. You'll then indicate in the survey what system you intend to use, and the next steps will be sent to you based on what system you choose to use. Also note that the email used to complete the survey will be the email that is used to receive communication from HHAX. We just want to note that because sometimes information can get lost, so just make sure that you know what email you're using, and that'll be where you'll get your next steps and any communication about sessions and things from HHAX will come to. To gain system access, you'll receive your provider portal credentials from HHAX within 3 to 5 business days after the survey is completed. HHAX system users will receive a portal to access member and caregiver information, EVV shifts, and reports. Third-party system users will receive portal access to review the data sent from their system to the HHAX system. There was a question about the soft launch. I'll back up to that really quickly. So the soft launch is going to continue through the remainder of 2023. Providers are not expected to meet the compliance thresholds that will be published in 2023. So right now it's getting onboarded and comfortable with the system, using the system, sending data, and then you'll be notified when you'll be expected to meet those compliance thresholds. So HHAX system users, DHS sends member information from MMIS to HHAX, which then connects to their provider portal. Providers will enter caregiver information into the portal. There are a couple options to enter that information. It can be done manually. HHAX also has a bulk import option that can be used as well. Providers are responsible to ensure that all the information entered into the system is accurate. Providers will review and approve shifts in their provider portal. And more information about system usage will be available after with enrollment with DHS and the provider enrollment survey is complete. So if you've already completed your survey, you should begin to get access to the portals and videos to assist with onboarding into the system. Third-party system users, once you've completed the survey, you also need to ensure that you've reviewed the business and technical specifications that are posted to the HHAX Provider Information Center. This will show you the requirements needed to connect your system and what your system must have to ensure that you're meeting EVV compliance. Once you're done with completing the survey, you must email the EDI support email address to begin the integration process. HHAX will work with, excuse me. Oh. HHAX will work with the providers and the provider's vendor to begin the testing and connecting to the data aggregator. All providers that are using a third-party system are responsible to review any rejections they may receive and then correct them in a timely manner to make sure that the data is correctly being sent between the systems. Training. HHAX uses a learning management system, LMS, for their training. Providers will receive their LMS credentials in 2 to 3 business days after completing the provider enrollment survey. There's only one username that's provided for the LMS throughout the provider agency, and all agency level EVV staff can use that to access the training. DHS monitors the status of completing LMS by providers. We have seen a strong correlation between providers that have completed the LMS training with confirmed visits and EVV usage. We've seen that providers that have completed it have been more successful in navigating the HHAX system. So we strongly recommend that providers complete the LMS trainings. There's several videos throughout that training or throughout the LMS to aid in navigating the system. All provider agency level staff need to complete all the modules in LMS to navigate the HHAX system. There's also job aids and guides in the provider portal. These can be used throughout the organization to aid in using the system. Training materials from HHAX will be available in Spanish, Hmong, Somali, Vietnamese, and Russian, among several others, will be available. Third-party system training. All provider agency level EVV staff need to complete the EDI module in LMS. So there's one module in LMS for third-party providers. This will help ensure that you're able to navigate the pieces of the HHAX system and for reviewing the data. You'll also have access to other modules in LMS to reference when using the portal to review data. So you'll have access to all the videos. We're just asking that you do the EDI one to help navigate. Providers using a third-party EVV system need to work with their vendor for training in their system. Caregiver and member training. All providers are responsible for training and ensuring caregivers, members, and responsible parties feel comfortable within their chosen system. HHAX system users will have access to the job aids and guides that can be used to aid in training caregivers, members, and responsible parties. providers may have to create additional training materials to onboard caregivers, members, and responsible parties. DHS is working to produce more, develop more guides and things to put out to help those have a better understanding of EVV. We also recently had an FAQ posted to the webpage, and so check that out for more of your, to get some more answers to your questions. We're committed to engaging providers, members, direct care workers, and other interested community members throughout the implementation. We're planning to have more of these sessions at the end of each quarter. Please watch for those updates on our webpage, and also sign up for our e-list announcement to receive any updates about EVV and more engagement sessions to come. We've recently updated our contact information to help direct people to where they can go to get answers. So we have, this is also on our webpage. Third parties should contact the EDI support email. HHAX users should email the Minnesota support email, that's the Minnesota specific email with HHAX, and should reach out to HHAX, contact HHAX for the system usage or training, system onboarding, and any issues directly related to the system and technical questions. The EVV team recently updated our contact to the DSD contact form, and we can be contacted in regards to policy related questions and DHS specific questions. And members and caregivers should contact your provider agency with questions or concerns about EVV. So like I said, we have moved from our email to the DSD contact form to help us streamline and to be able to better answer questions as they come in. And so this was implemented in February. And when you're contacting using the contact form to contact the EVV team, you need to have the following information: your full name, your email, your phone number, job title, company name, EVV system that you're using, and your provider tax ID. This information will ensure we can assist you in a timely manner. We use this information to find providers in our report so that we have a better understanding of how we can best assist you. There are additional resources if you'd like to learn more about the 21st Century Cures Act, the statute, Minnesota statute on EVV, the Safe at Home program, the links are here for the Minnesota Provider Information Center with HHAX, the HHAX FAQ, the DHS EVV webpage, and then our CBSM manual page is also here. So this is where we'll move into the questions. Please use the chat to ask questions. All confidential, private, and agency-specific questions should be sent using the DSD contact form. Everybody can see the questions that are coming in, and if they are being responded to, those are also being seen by everyone. So, and we'll work on answering some of your questions live here. So, home health providers. We got a question about home health providers. They should not be completing onboarding at this time. They should wait until they receive the notification to complete the provider enrollment survey.
Hey Amanda, just real quick, I want to add, I'm seeing a couple of questions about confusion on what is home health. So we'll drop a link in the chat, but if you go to our website, we have a list of affected services that are broken out by category of service for EVV. So things like PCA that did start on back in December, that's under the personal care services umbrella. Those are things that have to deal with supporting folks with ADLs and IADLs. The home health services are those services that are directed by typically a physician, like home health aide, nursing, physical speech, occupational therapy, and home, those sort of things. That's where that distinction comes in. So please do reference the chart on our website where there is a very clear breakdown about those. I'm seeing it come in about waiver services too. Again, those are all listed on our website. They're broken down really clearly in what phase they fall into. Waiver services, not every waiver service is in scope for EVV. Again, it's things that primarily have to address and support folks with ADLs and IADLs. That list is on our website and available for reference, and we'll drop a link in the chat to the website as well.
Thanks, Sarah. See a question about the recording. The recording will be available after this this session in the next, I would say hopefully sometime this week. And we'll get it up on the webpage as well. And there'll also be a copy of a PDF of the PowerPoint presentation as well.
All right, I'm seeing a question about service agreements and HHA exchange and not being able to add their members or caregivers. So a couple of things. Service agreements work. They're actually an automated process that comes over when the service agreement is entered by the lead agency into the MMIS system. That's where the service agreements live for the state. They get imported nightly to the HHA exchange system. So if they're not entered into MMIS, you're not going to see that person in your provider portal in HHA exchange, especially for new folks. And since everyone's new right now, you just won't see them. We are trying to work on figuring out some ways that we can either work around that, make it happen faster, which is honestly probably unlikely. So for right now, yes, we know that there are, especially like new service starts, you're just not getting folks over in your provider portal yet. We realize that, right now, since we are in that soft launch phase, we just ask that you continue to do EVV for the folks that you are able to. And as service agreements come in, then you can begin doing EVV for those people that you were waiting on. Hopefully in the future, we'll have more of a streamlined process or a workflow for that, but that is just something our EV team is working on. Adding caregivers, you should be able to add caregivers. There's a couple different ways that it can be done. There's like a bulk import form. You can send info over to HHA Exchange. If you're having issues with those sort of things, please do reach out to HHA Exchange. Use that Minnesota support email if you are using HHA Exchange as your vendor. And if you're still having some trouble, you can certainly use the DSD contact form to contact our team, but we do ask that you have already initiated a ticket with HHA Exchange. That really applies for anything that you're contacting us for. If you haven't started a ticket with them and you're not providing the ticket number to us, we will ask that you get that ticket first. That's how we track it. That's how we can look into things for you. Otherwise, you don't necessarily have enough information. So please make sure you do that step first.
I'm just going to define quick providers, caregivers, and members before we keep answering questions. So the providers are the provider agencies. Caregivers are direct care workers, PCA workers, home care workers. And members are the people receiving services. So I just wanted to define that because that was asked a couple times. Let's see. IHS services have begun implementing EVV. They were part of the December, right? Sarah, correct me if I'm wrong, but they're part of the December.
That's correct.
Yeah, okay. So they have begun. So if you're part of those services, first step is complete that survey, and then you'll begin the process.
I can jump in here, Amanda. There's a couple of questions about either signatures, time cards, timesheets, etc. So EVV does not have an inherent signature requirement. EVV does not require signatures to be in the system. However, there are services that are in scope for EVV, specifically PCA that do require signatures and additional time and activity documentation. So EVV doesn't change that requirement. You still have to meet those programmatic requirements for the services that you provide as an agency. If you choose to utilize your EVV system to capture electronic signatures, we do have some language in our FAQ that outlines what is considered an electronic signature, and also notes that you have to continue to maintain those programmatic requirements, policy, etc. So you would still have to capture the PCA time and activity documentation. So it really is up to each provider agency. If you are capturing it on paper and you're comfortable continuing that process, by all means, go for it. If you'd like to use your EVV system to replace paper documentation, we have some outlines on how to provide or to start that transitional process. Just with the note that you, as a provider agency, are responsible for ensuring that you are meeting all of those policy and statutory requirements. I'm just going to keep going with reading off some questions. I've seen a couple things about manual entries, edits, missed clocking, clockouts, that sort of thing. That answer is going to vary based on what EVV system you're using. I can certainly speak to the state system with HHA Exchange. There's some ability to edit shifts, especially if you're using the provider portal. But if a worker just doesn't clock in and a manual shift has to be created, that has to be done at the provider through the provider portal. The worker can't do that themselves right now. And then just manual and edited shifts, they're not considered EVV compliant. So right now we've talked about that there was an e-list that went out a while back saying that we're not enforcing any kind of compliance thresholds or requirements in 2023. But eventually those will be factored into, compliance thresholds and things like that. So, please try your best or have your workers try their best. And it is really important that they hit those clock in, clock outs. And we try to limit manual shifts, adjustments, edits, that sort of thing as much as possible.
So I want to just note that I see some people putting in stuff about contacting HHAX and their support. Like Sarah said, contact us and make sure you ensure that ticket so that we can then follow up on it and see where things are at. So I put the DSD contact form link in the chat for everybody. Oh, maybe not. Hold on. My apologies. I'm going to re-put it in the chat for people to have. So if you're having concerns with the system and you've submitted a ticket, please fill out that, and that will get to our team to help you navigate those things. So. Sarah, do you want to answer some more of those service agreements and shift questions?
Give me a second. I'm just reading and consolidating some of them here in my head.
Yep, nope, you're good.
I'm seeing a question about service agreements come through the system or only new ones. So because you're all new to EVV, they're all new. Fun fact. So they should all be coming through eventually. As people go through renewals and that sort of thing, you get new folks, people change providers. It's not going to constantly update, current ones. Only when changes happen, you'll get an update on change. And then when, a renewal or a new person, you'll get those automatically too. So again, if you're not seeing current service agreements for people that you support, we can do some troubleshooting, but you really need to reach out to HHA Exchange, make sure that you've got the right setup for your provider agency. Those of you who have reached out to us before and have done some back and forth, we typically find that it's likely that not all of your UMPs or MPIs are provided accurately on the enrollment form. So a lot of times we'll find people are missing either all of their their PCA folks or they're missing all of their waiver folks, and that's a really easy fix. We can just get an office created when you give us the right enrollment number. So that's really one of the first things to check, is making sure that you have those offices set up in HHA Exchange. That's where that's where the bulk of missing service agreements are coming from. Again, do reach out to HHA Exchange first, see if you can troubleshoot that, and then if we're still having some trouble, fill out that contact form, give us your ticket number. We can't figure out what they've done to help you without that ticket number again. And we can, again, try some troubleshooting things, but it really is on the HHA side of things. I'd see a request for needing IVR, so that's the telephony phone lines. Yeah, so you've got that right. It says, I understand that it's not currently available. So you are right. Right now, we have not yet made IVR available for folks. We have launched in a mobile first approach. Really, that mobile app is honestly the easiest, fastest, most comprehensive way to do EVV. It's the only way that'll let you replace your paper documentation with electronic documentation in the future, if that's something that you choose to do. It's also way faster and more convenient for people than calling in and hitting the dial buttons on the phone. But we will make IVR available in the future here. It's just not available just yet. And if you're not using HHA Exchange, you're using a third-party vendor. If your third-party vendor has it available, you are free to use it. Just because what's available in the state system through HHA Exchange does not dictate whether agencies can or can't use it when using third-party vendors.
Thanks, Sarah. Somebody asked about the communication from minutes compared to EVV. So we align with provider enrollment to ensure that we get the same messaging out to everybody. Unless it specifically says that we need a response, there is no need to respond. It's just for your notification purposes. So definitely keep an eye out in minutes mailboxes and e-list announcements and web page updates and provider news updates for all ways to get more information about EVV.
All right, I'll jump in here. I'm seeing a question about non-UMP number caregivers and how they're going to be identified. So the system works based on, right, so people that provide like PCA services and those individual enrolled provider services who have UMP numbers, they obviously have a unique identifier. But the system also is able to identify caregivers based on first name, last name as the first two identifiers, and potentially date of birth. It has to expand beyond that. So there is a built-in identifier just based on how the caregiver profiles are set up in the system. And then real quick too, I'm seeing some questions about scheduling and creating schedules. Again, this will vary based on EVV system, but again, in HHA Exchange, scheduling is not required. There is a way to create schedules and make things. It has to be done at the provider level through your provider portal. Caregivers can't individually do that, but you can copy it and apply it forward, so it just auto-populates. It also allows for, I believe they call it quick entry visits, which are those unscheduled visits that a caregiver can just clock in, clock out for as an as-needed basis, and they could do that, you know, forever if that's what works best for them.
There are member portals currently optional.
Yeah, so that the services portal on HHA Exchange is an optional feature. That's the feature that is, if a provider agency wants to use EVV to meet their documentation requirements, again, those paper documentation requirements, and switch over to electronic documentation, you could enable the services portal. That's where it will allow a capture of a signature. It's an electronic signature. It's not and it works on a basis of both the individual receiving services and the caregiver who provided those services approving the shifts worked, and the cares that were provided during that shift. It is optional. You don't have to you don't have to enable the services portal if you are using HHA Exchange.
There's a question about billing and compliant visits. Just want to address that. We understand that there's going to be some bumps right now, and so to continue to use your current billing practices that you use for your organization with DHS. And so right now we are not enforcing compliance through the EVV system through the end of the calendar year this year of 2023. And so right now we're just expecting providers to use the system and get comfortable with the system as we continue to get ready to post the compliance policy. But providers are not expected to meet compliance through the end of 2023. Somebody asked about the next sessions coming up. So this session we really wanted to use to basically establish where EVV is at and what it means for Minnesota and what the onboarding process is. And this will be available, like I said, on our webpage for people to review and for those that could not attend today. We really want to use the questions coming in today that we're either not able to answer or would like to provide for further clarification on for the next session. So this will be the only time that you'll be seeing all the onboarding steps through our engagement session right now. The next ones will be more of updates and using the questions from today and questions that come into our mailbox to really drive those next sessions and to give more clarity and updates. So we plan to build off of each session to help direct what the next session will look like. But like I said, this will be available for review after this session.
All right, I'm seeing a question about services provided out of state. So again, how you handle it is going to vary based on your EVV system. Those using HHA Exchange, those out-of-state visits are going to, they're going to come up with an error on the location. There is an option to select a community visit in the mobile app for the HHA Exchange users. Otherwise, those visits just hit to your call dashboard where it tells you kind of what the error is wrong with them, and you should all have a list of reasons for how to resolve those various errors. But they can get approved or rejected, and that sort of thing. It is best practice to have your folks, let you know when they're traveling on a state to make sure that you have the right, setups needed for those so that they can go through without issue. Seeing a couple questions about live-in caregivers. Once again, Amanda touched on it at the beginning of the session, but we're still working on, further defining that policy, and we hope to have something here soon. But right now, we're not expecting live-in caregivers to use the system right now. They don't need to at this point. So you, as provider agencies, should continue to do whatever your current processes are, and we'll update you and get a policy posted to the CBSM in the future when we have that finalized for living caregivers. Another interesting question that I see, again, specific to the HHA exchange system, is a window of time to accept placements in HHAX, and what happens if you miss the window. So that's a really good and really interesting question. We set up the configuration in the state of Minnesota so that provider agencies have 5 business days to accept those placements. So that kind of works on, or 5 days, sorry, not 5 business days, 5 calendar days. That sort of works on the assumption that someone is checking and looking for those on at least a twice a week basis. And if you miss them, they kind of just go out into the world of a waiting placement sort of status, and like a weird, like a on our end, on the payer end, they kind of fall into a no placement sort of thing. We can kind of see them in our payer portal. We haven't heard of anyone having that issue yet. So my recommendation, if that is you and you are experiencing that, would be first to reach out to HHA Exchange and see what they can do or how they can troubleshoot that. And then, if you're still having some trouble, you can certainly fill out the contact form and reach out to our EVV team.
Let's see, we've got about 9 minutes left in our session today. So we'll continue to answer questions. And again, if it's provider specific, confidential information, issues with HHAX that you have already submitted a ticket for, please fill out the contact form and include your ticket number so we can assist you. I'm going to throw it in the contact form in one more time, just in case it got lost. Yes, PCA agencies are required to use EVV as of December of 2022 in our soft launch period. And providers can continue to use paper timesheets. I don't know if you want to expand on that more, Sarah, but I think we went over it a little bit.
Yeah, I think you got it there, Amanda. I am seeing a couple times this question's come through about an idea of what percentage of non-living caregivers are using EVV with agencies at this time. I can't tell you that number right now, but I can tell you that we have seen about 70-ish% of all agencies have interacted with EVV in some way as of a couple weeks ago when I last looked at the numbers. So there's no way. One of the tricky things in Minnesota and why I can't give you the number on living caregivers or non-living caregiver percentages is just there's no way to identify a living caregiver. I can't tell you who who exactly is a living caregiver, whether they have an UMP number or not. And just because they're a living caregiver for one person doesn't mean that they're a living caregiver for someone else. So there is just no way right now of accurately giving you that data if we even had access to it. So just to be transparent there. And then, yeah, we have seen about 70% of provider agencies have interacted with EVV in some way. And that was as of the last data report that I looked at beginning of March or so. Oh, I saw a good question here too. Sorry, I'm just gonna keep going, Amanda. About if there's a manual way to enter if the caregiver doesn't have cell service or there's dead spots, that sort of thing. Again, I feel like I've a broken record giving this caveat with every answer that I give, but that's going to vary by EVV system. But with HHA Exchange, there is an offline mode, so it can still capture all of the data if they're not, and they're in a dead zone or out of service, or even just ran out of data for the month. It can be all that EVV data can be captured in offline mode, and as soon as the device reconnects to internet, whether it's data, Wi-Fi, whatever, it can just upload that backlog of visits, and all of the data transfers as if it happened in real time. So no worries there when using HHA Exchange. Seeing some questions too about edited shifts and them being non-compliant. Unfortunately, that's not something that the state defines what compliance is or anything like that. We can certainly define compliance thresholds and percentages that we'd like to see providers meet, and that is certainly something that'll be coming in the future. But the fact that an edited or a manual entered shift is not EVV compliant is based on CMS directive and criteria. So, I mean, I certainly will not. We will certainly not be posting a compliance plan that has 100% compliance expectation for providers. That's quite unrealistic because we certainly expect that everyone's human. There's going to be times when you forget to log out, have an issue, etc. There's going to be edits. There's going to be missed shifts, manual shifts. All of that's going to be factored in, and things that are, at a provider level that are not considered, non-compliant, or things that we might start reaching out in the later part of the year as we're getting ready to look at compliances. You're not using EVV at all. Let's get going. Let's help you through that. But numbers of edits and things like that will be a factor. However, there's going to be a good amount of grace there, as we know that's going to happen.
We have about 4 minutes left for people to put questions in the chat.
I do. There's a question it's more of a comment that just came in about in conversations with HHA Exchange, the caregiver has to click 5 tasks on the care plan at the end of the visit in order for it to be verified. Not 100% certain on that. We have been, when we configured and set up the EVV system with HHA Exchange, one of the things that we did not require is a plan of care to be implemented in the system. So it should allow shifts even without clicking on any cares to be provided. So I would reach out to HHA Exchange on that specifically and see if it's something that has been configured in your provider portal. There are some ability for providers to add features or restrict things further, add additional requirements within their portals. So it's possible that setting may have been hit, but I would definitely reach out to that Minnesota Support HHA Exchange email for clarification there.
Sarah, do you want to talk about the rounding time?
Sure. Yeah, so the HHA Exchange system is going to round just like traditional DHS rounding, so every 8 minutes. So I see a specific question here about if a caregiver clocks in 10 to 12 minutes before the start of their shift. Yeah, that'll when they clock in is when they clock in. So it'll just, it'll take from those units, or so if they're supposed to start at 1 o'clock and they clock in at 12:50, that is, that's going to round back to 12:45. So that unit will be applied obviously through the remainder of the shift. Yep. So again, one that just came in about billing and not having the service come in. Billing and EVV, whether or not you're able to send your data through or not, are not this time not related. Nothing about EVV should stop you from submitting your billing in any way. So, even if you are waiting on a service agreement from someone, or there's onboarding troubles, any kind of barrier like that, you as a provider agency are still able to submit your billing, get reimbursed, pay your workers all on time. There should be no implication. EVV should have no effect on your ability to do that right now. And then I think we have time. We're running out of time here, but so I think the last question is and then I'm seeing, I think a good one is, does HHA allow for an eligibility check for clients beginning each month? It doesn't have like a backdoor to minutes for like an MA status update or anything like that. So what you might see is the point at which someone loses eligibility, their service agreement goes inactive. Then you'll see in your provider portal. But you should definitely continue your current processes for monitoring eligibility. If that involves a minutes check or something like that, you should absolutely keep doing that. And the EVV system is not a reliable replacement for anything like that at this time.
I think that brings us to time. Thank you, Sarah, for assisting with answering questions. Thank you, everyone, for joining today. If your question did not get answered, please send to the DSD contact through the DSD contact form, and we will work to answer questions in the order that they have been received. And we will also be capturing the questions that came in. And so if they did not get answered today or we're not able to answer them today, we will use those questions to at our next session. So we hope to see you all again in a few months. And thank you so much for your commitment and dedication towards the implementation of EVV in Minnesota. We hope you all have a wonderful day.